Welcome to the first Lunch and Learn webinar in Pivotal Health Solutions education series titled Tech Neck to Perfect Posture. In this brief webinar, I'll provide a more in-depth look at a patient case study that was discussed briefly in a blog we posted a couple weeks ago titled Headache Patients Need Cervical Curve Correction. As all of you have seen in your own clinics, the posture epidemic is real, and we can begin to see the effects of poor posture in our patients as they begin to experience more frequent and longer-lasting symptomatic episodes that are less responsive to traditional chiropractic care alone. I hope to deliver some valuable evidence to you doctors as you search for ways to advance the level of care you provide your patients. The patient case study I will discuss is a perfect example of this scenario, as she grew up experiencing the benefit of consistent chiropractic care. However, as she progressed through college and into the early part of her career, she began to notice the episodes of headaches and neck pain steadily increased in frequency and duration. Additionally, she noticed the symptomatic and functional benefits of the adjustment were declining. This is when she arrived in my clinic, 5 days into a severe tension-type headache, looking for answers. First, let's look at how her symptoms were affecting her daily life using health questionnaires. Her preliminary headache disability index, as well as her health status index, R36, demonstrated a 60% disability, which indicates these symptoms were having a significant impact on the patient's quality of life. Now, let's look at the significant findings in her exam. Starting with the musculoskeletal portion. Reduced ranges of motion were noted in all 6 cervical spine measurements. Additionally, active trigger points were discovered in the suboccipital, SCM, and trapezius muscle groups. The findings of our radiographic exam correlated strongly with the abnormalities discovered during the musculoskeletal exam. Inherent with loss of cervical lordosis is altered spine mechanics, a likely contributing factor in the reduced cervical ranges of motion. The relatively flat atlas plane angle may be attributed to the hyperactive suboccipital muscles, and the anterior head translation or forward head posture is a likely cause of the trigger points found throughout the cervical region, contributing to the patient's headaches. Here you can see my initial diagnosis for this patient using current ICD-10 codes. M95.3, acquired deformity of neck, G44.209, tension headache, M54.2, cervicalgia, M99.00, segmental dysfunction occipital region, M99.01, segmental dysfunction cervical region, and M99.02, segmental dysfunction thoracic region. This patient's initial prognosis was good. She was a healthy 25-year-old female with no contraindications to care. So how do we fix her? Well, we know the functional care alone is no longer effective for her, and now we know why. Loss of the cervical curve. If we don't fix the curve, we don't fix the patient's condition, and her quality of life continues to steadily decline, and she's only 25 years old. Therefore, integrating structural therapy or cervical curve remodeling into her treatment plan is vitally important. Here are the details of our initial treatment plan. We treated her 3 times per week for 4 weeks utilizing trigger point therapy, diversified adjustments, posture corrective exercises, and iTrac therapy to restore the cervical curve. So after 4 weeks of care, how did we do? I'd say we did very well. Both follow-up assessments showed 0% disability, so we know the patient has experienced substantial improvement in her quality of life. Now let's look at some objective exam findings to confirm structural and functional improvement in her spine. The musculoskeletal re-exam shows normal ranges of motion and no active trigger points. Finally, let's look at the radiographic re-exam. We see great improvement. She now has a normal cervical curve, a normal atlas plane angle, and only a couple millimeters of forward head posture. And here's a look at the pre and post radiographs side by side. This is a snapshot of the patient's entire treatment plan. At this point, we've just completed this corrective phase. Considering the great cervical curve improvement the patient experienced during this phase, we now want to move her into the transition phase. The transition phase of care is designed to move the patient from the corrective phase to the maintenance phase using a tapering treatment frequency. This allows the patient's spine to adjust to less frequent therapeutic intervention and stabilize in her new posture while preserving symptomatic relief and maintaining structural and functional improvement. The corrective and transition phases are analogous to the corrective phase of orthodontic bracing, while the maintenance phase is equivalent to wearing a retainer once braces are removed in order to maintain the correction. For those of you learning about iTrac therapy for the first time, I'll provide a brief snapshot for you. iTrac is designed for those of you who desire to be on the cutting edge of rehabilitation. And considering the posture epidemic we are currently experiencing, there's no better time to begin integrating cervical curve remodeling. iTrac is a passive therapy designed to be an adjunct to existing functional protocols to maximize the therapeutic benefit to the patient. As we've seen in this case study presented today, when combined with a traditional protocol of manipulation, mobilization, and muscular strengthening, the outcomes are maximized. Keep in mind, many of the most common symptoms seen in your practice today can be attributed to loss of the cervical curve and forward head posture, of the most common being headaches and neck pain. Hopefully this brief lunch and learn provided some valuable insight into the growing need for cervical curve remodeling in your patient base. I would enjoy hearing from you. If you have clinical questions or would like to learn more about my experience with the iTrac therapy system and how you can integrate it into your existing practice, reach out to me. I'm proud to serve as iTrac clinical support for Pivotal Health Solutions, and I look forward to sharing more information throughout the year regarding this innovative product. Thank all of you for joining us, and have a great day.